Welcome back. We are going to start now with the phase 3 or the section 3 of our class. This likely will be the last section before we sit down and talk your personal situation with you. Now, here I'm showing you the things that you have to remember before I even talk about what are your different dialysis options. I want you to pay very close attention to this. Remember, no one type of dialysis that I talk about is going to be better than the other type of dialysis. Dialysis is about your own quality of life. So try to understand how your life is going to look and then try to take the decision. Decision for what type of dialysis you should do is your and yours alone, not your doctor's. Occasionally, you may not medically qualify for some type of dialysis, and if that's the case, your doctor will tell you. But otherwise, dialysis should be based on your choice. I want to emphasize particularly that as you hear about these things, do not let your fears dictate you as to which type of dialysis you should choose. I can tell you, dialysis has progressed significantly so that all the dialysis that I'm telling you here can be provided safely, and most people will do well on it if they feel their quality of life is going to be better. And finally, I want to tell you that at the end of this session, try your best to reach a decision for dialysis as if you had to start one today. This will allow you to make a decision and also will let us know whether you need more information about these things. You might ask, what are the different types of dialysis? I've shown it here. There are two main types of dialysis. One is blood-based dialysis. The second is water-based dialysis. We call the blood-based dialysis as hemodialysis. The water-based dialysis is called peritoneal dialysis. So let's first talk about hemodialysis. What is hemodialysis? Well, hemodialysis means the blood is drawn out of your body, runs through a filter, and then returned back to your body. When it's running through the filter, the toxins come out. This is, in a nutshell, hemodialysis. How do we get the blood out of the body? Well, I'm showing you here the different ways the blood can come out of your body to run through filter. The best method, which is a fistula that connects your blood vessels internally. Unfortunately, it requires about 3 to 6 months to mature. Hence, if one was to do hemodialysis for her or his kidney failure, they should plan well in advance. Some people may not have a feasible AV fistula. Those people may require a synthetic tube inside the arm, as the middle photograph suggests. That's called AV graft. Again, the AV fistula or AV graft requires advanced surgery and notice so that you are ready for your dialysis with an access which is working by the time you need to start dialysis. Unfortunately, many people cannot either decide for dialysis early, one, or two, do not have the luxury of having seen kidney doctors in well in advance. Those people sometime end up in an emergency room needing to begin dialysis. If that's the case, we use this third option, which is a catheter which goes down your neck into the upper part of your heart, and that provides access for dialysis. This needs to be avoided. It's one of the reasons why we suggest to decide for dialysis early. How can you do hemodialysis? Well, there are two ways you can do hemodialysis. A majority of hemodialysis patients, more than 95-98% of hemodialysis patients, do hemodialysis by going to a center. They go 3 times a week and receive 4 hours of dialysis each time. So they receive about 12 hours of dialysis in a week, but they have to go to a center. The usual schedules are Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday, and requires you to strictly adhere to the schedule and arrange your transportation. The same hemodialysis that is done in the center can be done at home. Usually your doctors will prescribe it to be done 5 to 6 times a week. It can be a little bit shorter. And it does not require travel commitment, but it does require training to make sure that you can safely do that. So now let's talk about the different things you might want to consider before deciding whether you want to do hemodialysis at center or at home. Let's start the talk with in-center hemodialysis. In order for you to do this dialysis, you have to reach to a center. So there are obvious traveling requirements. Because you are doing this dialysis in a center, there is a fixed schedule for you. Most people will do Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday, and would be allotted a specific time period, which means you have to reach before that and leave at the prescribed time. It's a blood dialysis. So before they do dialysis, they will insert 2 needles in your fistula or graft each time. It's done 3 times a week. So during dialysis, your toxin level will fall. After dialysis, as you get off dialysis, your body will start again accumulating toxins, and it will have 48 or 72 hours to accumulate that toxin. You again go for dialysis, the level will fall in 4 hours. It again will rise over the next 48 to 72 hours. And it keeps going. So if you followed your toxin level, they keep going up and down, up and down. If you do get infection on this dialysis, infections usually go to blood. And since blood goes everywhere in the body, the infection is systemic or spread out. And finally, this dialysis, since the nurses and the technicians are doing for you, you don't have to receive any training for this dialysis. What if you decided to do home hemodialysis? Well, the travel and scheduling commitment here will just literally go away because you are going to do it in your comfort of your home. The needle requirement, though, will continue to stay. So either you yourself or one of your partners will insert 2 needles in the arms. It's usually done 5 to 6 times a week and about 2 to 3 hours each time. So the total duration of dialysis remains roughly same as in-center dialysis, about 12 hours or 12 to 14 hours a week. What benefits is that because these hours are at your convenience and schedule, all of a sudden you don't have schedule and you can weave it in your lifestyle and when you have free time. Again, here also infections are in the blood, hence spread out. I do want to mention though that we have studied this well, and the rates of infection, whether you do dialysis at home or in the center, are same. So it's not that when you do it, the infection is higher. And finally, because this dialysis is usually done by you or your partner, it requires a training. The training for home hemodialysis is about 5 to 6 weeks, depending on your center. So let's see the technical consideration, what you need to think in terms of your lifestyle and your feeling for in-center hemodialysis. Like I told you, since in-center dialysis, your toxin level goes up gradually and fall aggressively, this is a little bit aggressive dialysis because we cannot keep you here with us in dialysis unit for a long time. We try to achieve efficiency. Of course, the side effect of that is that when someone has other medical problem, such aggressive removal of fluid or toxins can cause after dialysis fatigue or a post-dialysis weakness. On an average, that lasts about 4 to 6 hours. The other concern is, if it is aggressive, is it more dialysis? The answer is no. It just means you will get the same weekly dialysis in that shorter period. Since it is over a shorter period though, you might feel it's going to be better because it occupies less time of your life. Unfortunately, that may not be true, because aggressive dialysis might mean that you may have some symptom after dialysis. And the final thing that I feel all patients should know is how much of active life you are going to spend on the dialysis away from your family. And as I told you, it's 3 hours 4 times a week. That's about 12 hours of dialysis. And since it has a schedule and transportation requirement, it usually is about an hour and before, an hour after, even discounting the fatigue that one may or may not get after dialysis. So on an average, it's about 6-hour commitment on the day of dialysis, about 18 to 20 hours for the week. The same thing on home hemodialysis, if you consider. It is done more frequently, hence it is a little bit less aggressive. The quantity of dialysis is roughly about the same, but the discomfort related to dialysis many a time does go down. The time that you spend on actual dialysis, that is 2.5 hours 6 times a week, is 12 to 14 hours, is about the same. Where you save is your need for transportation and schedule. So the total weekly time on this home hemodialysis usually is about 14 to 15 hours in a week. And finally, home hemodialysis, because it is technically more engaging, it requires a slightly longer training. So the training for home hemodialysis is about 5 to 6 weeks, depending on your center. And of course, it requires a partner to be present with you, not 24 hours, but just at the time of dialysis. So based on your availability of partner and your desire for independence or schedule-free life so that you can spend time with your family, you need to decide if you are going to do hemodialysis, which type of hemodialysis you want. Next, I'm going to talk about the water-based dialysis, which is peritoneal dialysis. Because the obvious question that you might have, do I have to spend so much time and effort or the bondage of travel and scheduling for my dialysis? And the answer is no, you don't have to. Let me tell you about peritoneal dialysis, or what we call PD. Like I told you, it's a water-based dialysis. And the simple way of thinking about it is that usually we put dialysis fluid in your belly. Your belly has a bag inside, which is called peritoneum. Your body sees the clean dialysis fluid and throws the toxin in there. And when we take out the fluid, the toxins come out of the body. If we do it enough number of times, the body gets clean. This is not a blood-related dialysis, so you do not see blood at all. So how do you put fluid in the belly? Well, let's first understand what is peritoneal dialysis. All of us have a bag, an empty bag that surrounds our gut inside our belly. We live our entire life with that empty bag. That bag is called peritoneum. I usually ask my patient to pronounce it with me, peritoneum or peritonium. What we do for peritoneal dialysis is we slide in a catheter in that bag. So on the right hand side, you can see how the person has a catheter slid in that bag and how it looks outside. It's a small surgery, similar to what you would require for vascular access if you were to do hemodialysis. Most often it's a day surgery, similar to vascular access for hemodialysis. And usually people go home the same day after surgery. Couple of weeks after surgery, this is completely healed. And a person is ready to begin training for peritoneal dialysis. Training usually requires about 4 to 8 days. On an average, about a week. And then the person does the dialysis at home. So in order to do peritoneal dialysis, we need to fill the peritoneum and drain it. How do we do that? Well, we can do it in two different manners. One is manual PD. Manual PD is the simplest form of dialysis. Most of you have received IV fluids in your veins in the hospital. And you know that they just hang the bag and it just goes in. The same way in manual PD, you would just hang a PD bag at your home and connect the tube to your catheter. You open the clamp, the fluid will just run in your belly. When you want to drain it, you just open the drainage clamp and it will run out of your body. This is the easiest process. The whole process takes about 10 to 12 to 15 minutes. You do it 3 or 4 times a day, similar to coffee drinking, and all of a sudden your dialysis is done. If you did not want to do manually, you can also do PD by machine. And again, it's not very difficult. A machine-based PD usually is done at night because most people are sleeping at night. This again is very simple. Instead of you manually filling and draining your PD bag, what you do in machine-based dialysis is you sleep on dialysis, which means the machine will do in and out for you as you are sleeping, and the dialysis occurs while you sleep. The way it works is that somewhere in the evening, you will take a couple of PD bags out of your closet and put it on the machine. And as you are about to go to sleep, you will connect those bags to your catheter. You will hit that green button, go, and the machine will run PD fluid into your belly and out of your belly through the night. Usually you don't feel anything, so the whole night you are sleeping and the machine finishes dialysis. When you wake up in the morning, the bags are empty, you pick it up, put it in garbage, and you are done. I'm not saying you are not going to feel anything, because first week or so, many people feel a little bit weird, so they don't get as good a sleep. But beyond the first week or week and a half or two, usually most people adjust well, and then it becomes just a part of their life or sleep life. Most of the training that we do in these type of dialysis is how to wash your hands and how to make the connection. So if you do choose this type of dialysis, what are the benefits for you? Well, like I told you, both manual and machine dialysis takes very little time. So manual is about 15 minutes 4 times a day. That's about an hour of time in a day, but usually within your home and spread throughout your life. So usually you just take out 15 minutes somewhere. Alternatively, if you do machine, preparing the machine in the evening takes about 15-20 minutes, and then disconnect in the morning requires about 5-10 minutes. So again, about half an hour a day. So if you see that way, PD is like taking medications at home, except that it's a process and it takes roughly about the same time. But it allows you to live your life as you are living right now. You go to dialysis clinic and meet your doctor about once a month. So the requirement to travel to hospital or clinic is minimal on PD. Most of the time your supplies and everything comes to your home and is delivered to your home. You do have 24/7 nurses available to you for talking on phone, or if you needed to visit the nurse for any particular reason, they would be available daily. So PD has all the benefit, but because of the simplicity, most people require minimal support at home beyond the first 2 or 3 weeks. It's a purely water-based dialysis, so you are not going to put needles in your arms. And it's amongst the most friendly dialysis because it can be done within your home, within your schedule. And if you wanted to travel, even at the last moment, you can just pick up your machine or bag and just go. Does this mean that peritoneal dialysis does not have any other requirement? Should you not worry about it and just choose PD? No, there are few requirements for peritoneal dialysis. One is you will need to have a catheter in your belly. Very small surgery, all the same, you will have catheter in your belly. It's similar to the access that you require for hemodialysis. So in some ways, there is a need for that surgery. The catheter is visible, but most of the time will stay under your clothing and most people won't be able to figure it out. It does make you restricted in public pool swimming. It does require you to do dialysis all 7 days. It's easy and takes little time, but does require dialysis all 7 days. The supply that you get is usually once a month. So it requires about half a closet space for you to store. It requires training, but training's not as long as hemodialysis. In fact, most people who can do basic functions of their life, just walking around in the house, cooking, eating well, making coffee, most people should be able to do. We do ask that you have a little bit of dexterity in terms of capping and uncapping a Sharpie or something similar. And finally, it does make you responsible for your dialysis. Similar to taking your medicine, it does require you to remember that you need to connect to dialysis every night before going to sleep or something similar. You will have enough support, you will have enough reminders, so you will know that you need to do it. But this is something becomes a part of your life beyond the first 2, 3, 4 weeks. Let me now tackle some of the questions that you might have for peritoneal dialysis or PD. You might wonder, I do hemodialysis 3 times a week or 6 times a week. Why am I doing PD every day? Well, the obvious reason is that PD is a slower, gentler dialysis. And because of that, it makes sure that your body remains in relative harmony. Your cleaning, if you do it machine, occurs over the night, 8, 9, 10 hours. So there is no big swings in your toxin and fluid level. So slower and gentler also means doing it more frequently or all 7 days. Remember, your kidney right now, whatever its function is working 24/7, and that allows you to feel a certain way constantly. Though you do this every day, it doesn't mean it occupies all of your day. In fact, manual PD, if you were to do, can be done just by 15 or 20 minutes 4 times a day. You can do it when you are having coffee in the morning, about lunchtime, about evening coffee time, and just before going to bed. And each time it will take about 15 minutes. If you did the machine, it will take about 20 minutes in the evening and about 15 minutes in the morning. However, despite such low time of doing dialysis related work, it does provide you a relatively gentler and continuous fashion of dialysis. So your body is able to adjust better. And many a time, in fact, most time, patients on PD do not have these symptoms after dialysis of fatigue or being drained out. It does not require someone to be with you 24/7, even when you are on dialysis. It's a simple enough dialysis. There are no major emergencies on dialysis. So you do not need to have someone living with you. You could be alone at night, just connect yourself and disconnect yourself. You don't need anyone. It does require training, which is smaller. And once you are trained, the chances of problems at home are minimal. In fact, some people wonder, but what if there is a problem? And we always say that even if that happens, the most often you are able to tackle it with simple procedure, or worst case situation, you could either call your nurse or switch off the dialysis and deal with it next day morning. So now that I have told you about different types of dialysis, let me pose this in a different manner. What are your dialysis options? And I think the way you want to think is not what type of dialysis you want to do, but what lifestyle you want on dialysis. And so maybe what you might want to think is where you want to do dialysis. Do you want to go to a center-based dialysis where you have traveling, scheduling needs, and other things? Or you want to do home-based dialysis where you have freedom from scheduling and travel and a relative constancy of life. Before you start your personal discussion with your educator next, let us go through some frequently asked questions that many people have asked us over a period of time. So, question 1. Why do I have to decide for dialysis this early, since my doctor has not told me to begin dialysis? As a kidney doctor, we feel that you should know what's coming down the road for you. Also, as we discussed, many of the dialysis related things need preparation. If you are going to do hemodialysis, you need about 6 months or so to start working on your access. If you are going to do peritoneal dialysis, it will require sliding in catheter about a month or so in advance. And all of these require your doctors to know what type of dialysis you are thinking of so that they can take appropriate action so that you are ready for these things. So it's important that you decide for your dialysis early, at least 6 months or a year or 2 years in advance. If you ever need dialysis, what you're going to use, that will allow better preparation. You will avoid emergency room, and avoiding emergency room means avoiding complication, avoiding problems. Question number 2. Will it cost me more if I do dialysis at home? Not at all. Most dialysis are paid for by your insurance agency, VA, or CMS in a similar manner, which means your pays, co-pays, and all the requirements are going to remain the same. Question number 3. Why are you asking me, doctor? Why don't you choose dialysis for me? So, like I said in the beginning, dialysis is a personal choice. It's not a decision to be made by your doctor. It is the decision to be made by you and your family based on your personal preferences. Question number 4. Doctor, if you had to choose dialysis, which dialysis would you choose? This is a difficult question to answer. At this time, since I'm not suffering from kidney disease, my answer may not be genuine. But I must tell you that when we did do a study asking kidney doctors and nurses if they had to do a dialysis, which dialysis they would choose, 90% of them told that they would do dialysis at home. Half chose PD, half chose hemo. Only 10% of doctors and nurses felt that they would go to a dialysis center to do a dialysis. Question number 5. I'm not a medical person. Can I really do dialysis at home? What about infections? You do not need to be a medical person to do dialysis at home. As I told you in the beginning, now the dialysis technology is advanced enough that most, if not all, people can do dialysis safely at home. The chances of infection, and we have studies for this, are same whether you go to a dialysis center or you do it at home. More importantly, PD versus hemo, infections in peritoneal dialysis are local to belly and usually easily treated. Infections on hemodialysis are more systemic and spread out. But again, overall, yes, you don't need to be a medical person to do dialysis at home. Next question. What if there is a complication? Remember, you will receive training for each dialysis. You will know at the end of training how to deal with any problem that may arise. Your nurses and doctors will not let you go home unless they think that you are fully trained. Most of the problems that occur on PD either way are minor problems and usually are not emergencies. Hence, many a time they can be easily dealt by simple things. And finally, if you needed someone, you can always call your on-call nurse. But again, it is uncommon to have major problem on dialysis at home once your dialysis nurses have felt you qualified enough to go home. Next question. My friend or cousin or doctor or parents, etc., have told me that one of the dialysis is better than the other dialysis. Should I listen to them? I'm glad that you have talked to your friends and family about your dialysis need. It is good to receive input from everyone. Unfortunately, it is possible that not everyone knows everything about dialysis and people may have misconceptions. So if you hear new things about dialysis which is not your understanding, always try and clarify with your provider. Next question. Internet is an excellent tool for receiving information about kidney disease related problems. There are lots of legitimate governmental and private foundation based websites which provide excellent information about kidney disease. There are lots of social media chat rooms about kidney disease. We encourage that you visit these things and receive information for kidney disease. Remember, it is difficult to figure out whether the information that comes from internet is correct and applicable to you or not. So if you receive any new information, please check with your provider. This concludes the phase 3 of our education session. Again, I'm going to stop here and I'm going to let you talk with your educator. Your educator is going to ask you questions. You answer them as best as you can, and your educator will clear up any misconceptions that you may have had. Once you are done with the session with your educator, the final thing the educator will do is ask you your opinion as to 1, whether you know what type of dialysis you want to do, and 2, how confident on the scale of 0 to 100% you are choosing that dialysis. After that, the education will finish and you will go home. You will fill up your post-education surveys and mail it to your study staff. The study staff will get back in touch with you on phone, or please call study staff and organize for any further need. Thank you very much.